Hi, I'm Dr. Adam Rushford. Welcome to Hands On Health Chiropractic.
I started having headaches in fourth grade, migraines, and no one had any answers for me other than to take medicine for them, and all the medicines they gave me made me really sick to my stomach.
Oh, I thought chiropractors were crazy. I didn't believe in it. I thought it was kind of the same as acupuncture and some other things that I just didn't really have a lot of faith in.
Historically, I've been somewhat skeptical about chiropractic.
But we both had issues with our backs, and we're just looking for solutions. So we thought we would give it a try.
We have patients that find their way in our office. They all come from different phases and different walks of life and different stress levels, but they're all looking for the same thing. They're looking to not only be able to find health, but also to be able to maintain health throughout their years. That's a very strong push that we have in this office, to not only to adjust you back to health, but also to empower you, to give you the tools to be healthy outside of the office. In the long term, in the big scheme of things, I want to be able to use all my expertise, what I've committed my life to bringing you health, bringing you strength, bringing you youthfulness throughout your entire life.
Other chiropractors I had seen before, I still was having the headaches. They were getting a little better, but there was nothing. They didn't give you anything to work on at home, or ways to make it better other than just coming to them. You go in, they adjust you, you leave.
Actually, I went to another chiropractor in town, and I just felt that I wasn't getting personal attention. I saw different people every time I went in, and a friend recommended coming here.
There's a lot unknown about what a chiropractor does. There's a lot of fear when somebody first comes into an office. So clarity about what a chiropractor does, clarity about what their condition is and what their spine looks like. I really take time to go over each and every x-ray with every patient so they understand exactly what I see and what I know. And also clarity with what it takes to correct it. I do very clear-cut corrective programs for patients. All right, with each different phase of care, we spell out exactly what we're going to be doing, what to expect, and what our goals are. It's the most important thing, to have goals with what you're doing here.
I think the biggest change is probably the education.
And we have a young man who has absent seizures. He did some research and showed me some articles and some journal articles and things that said cervical manipulation had effect to help reduce the seizures. And we took a look at his spine through some x-rays and other analysis that he did, and said he thinks he might be able to help. And we've actually noticed a reduction in seizures.
Adam showed me some x-rays and some photographs, both before and after a few months of treatment. I was just blown away by the change that had occurred.
And I kind of like it because he be really nice to my parents, and I love them so much. I'll protect them.
Thank you. I feel like there's more of a plan rather than come see me twice a week and I'll adjust you and see you in 3 days. So I like that. It's working.
I was about halfway through my schooling. I actually had a really bad injury where I slipped and fell. It really damaged my low back pretty severely for somebody my age. So I started actually going to see a chiropractor. And while going to see a chiropractor, not only did I get great care and got a lot better, but I started to learn the why a chiropractor does what he does. And that why was the most important thing for me. And that's what kind of, as soon as I learned that, there was no second guessing what I was going to do. I knew this is what I wanted to do for the rest of my life.
Well, you trust him.
I think that's probably the biggest
You
thing.
have to trust a healthcare professional.
Yeah. I think he just exhibits a level of knowledge and understanding specific to my needs that I was able to develop a rapport and trust, with them.
Mm-hmm.
I feel like he takes the time to talk to you and see how things are going.
I trust him with my family and the care of my family, so I feel like that's the greatest compliment that I can pay to somebody, especially a medical provider. So if I trust him with my family, then I would wholeheartedly recommend that everybody trust him with their kids. I mean, there's no greater trust for a father to display than to let somebody manipulate his kid's spine, even down to an 18-month-old. He adjusts Sam, and we notice improvement. So I guess if I trust him, so should you.
So when patients first come in here, it's because they've lost health. And what we've noticed with a lot of our patients, once they start to feel good, it's something that you like. It's something you get. I want to say the word addicted, but you get so used to feeling good, you don't want anything less than that.
I don't think that I'll ever leave. I like coming here. He fixes me.